I'm Dr. William Davis. I'd like to talk to you about something I call DIY healthcare, do it yourself healthcare. I believe we've entered a new age, a new and exciting age where everyday people can take control of their health, something that was never before possible. In prior years, the doctor was in charge of uh, telling you what to do with your health. He had all the information, he wrote the prescriptions, he told you to go to the hospital for testing. All those kinds of things we're familiar with in that paternalistic model of healthcare. I think the tide has turned. It's now time for everyday people to take back control over a lot of their healthcare. And you know what? The results you can obtain are, in many, if not most cases, superior to the kinds of results you would get from your doctor. One of the first tools that we have now available, information. The information playing field has been leveled. The same study that your gynecologist, neurologist, gastroenterologist, or cardiologist can read, you can read over a cup of coffee. You might not have a full appreciation for all the data, but you can get a pretty good idea what the study is about and who paid for that study also, because lots of studies are paid for by the drug or medical device industry and therefore no better than marketing. And you can make that determination and decide for yourself how good that information is. We have the tool now of collaboration. Online tools for collaborating with thousands of people. You know what happens when you put thousands of heads together, insights, experiences, and ideas? You trump the wisdom of any single expert, no matter how smart. So the collective wisdom, the wisdom of crowds of thousands of people, is now better than the wisdom of any single expert or group of experts. And that means you and I have access to astounding levels of collaboration and also ways to sift through the information. We also have an explosion of health tools. You know, I have lots and lots of people who've used a simple glucose meter, a $20 glucose meter, to accelerate weight loss very effectively, to break weight loss plateaus, and to get rid of type 2 diabetes. It's quite easy. That's just a simple glucose meter you can use on your own, and you do not need your doctor to tell you how to do that. You can monitor your own EEG now with a headband that tracks your brain waves, and you can use it for biofeedback to get deeper states of meditation. Asthmatics can now apply a device to their inhalers that identifies triggers of asthma attacks that allows them to reduce the frequency of asthma attacks by 2/3. Parents can now apply a simple monitor to the infant's chest, and it monitors temperatures, and it gives a signal on the phone if the child develops a fever, say in the middle of the night, and then you can do something about it. There's a new device that infants can wear as a sock. It's a soft cloth sock, and this monitors blood oxygen. And it tells the parents if blood oxygen drops, as it would prior to sudden infant death syndrome. So an incredibly life-saving new tool. These are just a small sample of the exciting new tools that are becoming available to us that we can use on our own and do not need the doctor to order to show us how to use it. We can use them ourselves. And what's even more powerful? If you can track something, you can change the course of a condition. So if people, for instance, are given a way to quantify and track their Parkinson's disease, there's a new device, by the way, now that tracks the severity of Parkinsonism using voice patterns. It's even more accurate than MRI scans of the brain. Well, if you have that, thousands of other people have it, and we can track your Parkinson's disease. People are going to fortuitously identify factors that influence it. Not the drug industry, not the doctor, not the medical device industry, all seeking to make money. We can collaborate. Thousands of us can collaborate and identify new associations, new solutions, and then share them with each other. This is going to be the new frontier in health. It's not going to be a new transplant. It's not going to be some new operation, some new procedure, or some genetic insight. It's going to be the fact that we all collaborate and find solutions outside of healthcare. That's why I call it DIY health.